Good morning, everybody. Can you hear me? Thank you.
Okay, can you guys hear me now?
Yes.
Yes, we can.
Okay, we're gonna start in, let's do like 2 minutes. Let me go round up the other people that are here in person. And just so you guys know, in the future, we will be doing the hybrid meetings for a while, if not forever. I'm not quite sure yet. But me and John Carroll got to hug it out and touch since we're both fully vaccinated. So human touch outside my household. I'm super excited. So let me go round up the others.
Do you guys have a camera in the conference room over there?
Okay. How I do it. Okay, thank you guys for your patience. Just a reminder, this meeting is being recorded, and if you talk, please say your name before you talk. So Jolene Houseman, we're gonna go ahead and call to order at 9:35. The first hybrid MCC meeting and the first hybrid meeting PPACG is held. So please bear with us here while we learn the ropes. We do have a quorum, right, Jessica?
Who is on call right now? I'm taking minutes for the first time, so we're just really all doing new things.
And for the people on the phone to hear you, your red button has to be on. The talk one.
Hello? Can everybody hear me? Okay, I see Sharon.
Yes.
And for a reminder for those in the room, when you're not talking, turn your red button off because only like 3 red buttons at a time work, or else then it gets weird. Okay, so has everyone had a chance to look over the agenda?
Yes.
Okay, is there a motion to approve the agenda?
So move, Sharon Brown.
Second, John Carroll.
All those in favor?
Aye.
Aye.
Any opposed? Great. And then has everyone had a chance to review the minutes?
Yes.
If I can get a motion to approve the minutes?
I'll move to approve the minutes. John Carroll.
Dick Idle seconded.
All those in favor?
Aye.
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 Dick, I love the hand raising. It makes so much more sense. All those opposed? Okay, before we go into public comments not on the agenda, we have some new faces. So Gail, if you could introduce your partner there.
Hold on just a second. I'm getting caught up. Who approves agenda?
Yeah.
Sharon was first. Okay.
And then the minutes, John was the.
Okay, thank you. Okay, I'm getting caught up. Thank you.
What's your red light? Red light. So Gail Nels with Invita, and today I brought along a guest, Claudette Sanchez. If you would introduce yourself as.
Hello, everyone. I'm Claudette Sanchez. I'm the new executive assistant for Invita. And it's a pleasure to be here. Thank you.
Phil is very excited for you to begin at Invito, as we can all see. I'm very excited. So when I come in the building, I don't just wander around trying to find someone. So welcome, Claudette. And this is not your first. Okay. Right. Okay, does anybody have any public comments that are not on the agenda? Okay, I just have one public comment. I would like to thank Dick for the recommendation for the catalytic converter cages. We are getting those installed on all our vehicles. Our lovely insurance, because of every roof being damaged with hail and the damage to our vehicles over the last year, is increasing 15%. And all our deductibles are going up. So Dick, thank you for that, because hopefully that will help us in the future reduce those costs. So I highly recommend those catalytic converter cages to everyone, because the people that are stealing them can get under a vehicle, cut your catalytic converter off and get out of under your vehicle in less than 60 seconds. So they are fast and they are good. So, and they are out. We had another one stolen since the last meeting. Oh, you guys are gonna be next. Yeah. And then Silver Key is building a fence for their vehicles. The city of Fountain is gonna let us start parking behind their fence as well. And I highly recommend, if you could do that, reaching out to your insurance providers, because your deductible, your rates will go down with that as well if you have a fenced yard for your vehicles. We don't have any new membership appointments. This month, we do not have provider presentations due to the CASTA conference. So instead of doing provider presentations, what I'd like to do is, for those that were at CASTA, if you could take a brief moment to maybe share something you learned or share your favorite part of CASTA. The CASTA conference will be in Grand Junction in September, October. The fall conference is like way better than the spring conference. So I highly recommend everyone go. Plus, it's like 30 minutes from Moab. So I recommend taking a long weekend afterwards. That's what I'm doing. But it was a great conference. I'm going to go to Erica first, since I saw her there a lot. No pressure.
Pressure. So is mine on? Okay. So our favorite part of CASTA?
Or something you learned.
Well, a large portion of it, I was actually in the CCTS training. So that's the well, Phil was too. Oh, no, and Phil was not. Nancy was. So that's the community, I can't remember, transportation supervisor. Since I'm new to the transportation arena, specifically with seniors, I'm familiar with like the DD population and everything. So that was really good. The presenter and the trainer was fantastic. And he brought in a lot of different parts, not only with transit, but just with supervisory, I don't know, initiatives in general. He did really well. I really was impressed. And then just being able to network and see people in person was great. It was a little weird at first with no masks and everything, but I feel like I got to know, especially like Phil and Gail and Jolene, Laura, a lot better than I had known them. And so we can move forward with partnerships, and it was great.
Laura, the esteemed speaker at CASTA, who presented several times.
No, I had to recover from that. I think a couple of things that I learned that I want us to explore as a group is Unite Colorado presented in one of the groups, and Unite Colorado is a initiative kind of stemmed out of healthcare, and it's a referral program, technology program to refer people to agencies that for things like food assistance, transportation, case management, just about any kind of human services need that a person may have. And Unite Colorado is just a centralized platform to be able to provide those referrals to other agencies that are on the platform. So say, for instance, somebody calls Mountain Metro, and Mountain Metro gets a call from an individual who needs specialized transportation services, that needs added help, or may fall outside of the service area of Mountain Metro. Instead of having to have that person call a Silver Key or an Envita or Fountain Valley or others that are on the call, that referral could be made directly from Mountain Metro to one of those agencies, and that agency would connect with that person. And so I think there's some opportunities for us to kind of explore how that may work within the transportation space. And so I'd love to have some people from this committee to just kind of go down that path of exploration with me to see how it may work. And so I'll be kind of engaging some of you guys in that. I know probably some of you in the room are already familiar with that program. Some other things that I learned from the conference is just the basic need of connecting with other individuals that either provide a similar service or provide a expanded service from what you do. And so I sat in some meetings that weren't very applicable to my current job, but I sat in some scenario meetings that were kind of fun. I know that Phil was in one of those, and Allison, I don't know if you're on the call. I don't see you on the call yet, but Allison from MMT was in one of those sessions too, but just kind of talking through scenarios of ADA compliance. It was really fun because the leader was really fun. Phil's laughing. But it was super helpful for me to step into those shoes because I don't necessarily have a great connection with the day-to-day that a driver, day-to-day issues that a driver may come across. And so just the cross learning was very helpful. So those are a few things that I gathered from the conference. Phil, I'm passing the torch to you.
Thanks, Laura. Okay. One of the sessions I really liked was with the City of Estes Park and Via Mobility around emergency management. And they kind of shared what happened with the fire last year and this kind of serendipity that occurred with Via sent a vehicle and a driver up there to actually retrieve their vehicle from the city that was in danger. And then they ended up helping evacuate some of the last people that were left there without transportation. Anyhow, that kind of made me think, I was here, what was that, 10 years ago, when we had those couple of fires. And when it's you in your city being threatened by something like that, it's terrifying and not really conducive to rational thought, I guess. Anyway, my point is, I think that I'm going to think through, ways to plan in the eventuality that one of our neighboring communities, Pueblo, Woodland Park, Castle Rock, has some kind of disaster like that. How can we proactively step in and be there to transport people or things, whatever the need may be, because we're not in the midst of it. We can think more clearly and we can be there to help. So, that was my big takeaway. Although I got the pleasure of presenting too, and that was a lot of fun. So let's see. Gail was there. Go ahead, Gail.
Thank you, Phil. I enjoyed just aspects of just seeing everybody in person again. And the word I came away was, it's just so fun to see people without masks. It was just so, and it was wonderful to meet peers that just really supported their community and how they did that. The takeaways from the sessions I attended, I enjoyed the emergency planning. We do some of that for home care, but then to look at it and have it written down, what all things could or should we be including was helpful. And then I really enjoyed, just even being reminded from Laura about, well, the census is going to change everything. And so how we view that, I think, is important to start thinking about as an organization. And then I participated or attended the statewide planning one held by the CDOT people and their planning. And what that looks like, how the regional plans flow into the statewide plans, and then how the specialized plans go into the other transit plans. And, it is really complex, and how we look at our community, not only in 5 years out, but, 30, 40 years out was important. So I was encouraged by the great minds in the room thinking big thoughts. So, anyone else?
I was also at the conference. I have to say one thing that impressed me, it was a small conference and the majority of cast and memberships are from the much larger Denver metro area. And considering that Laura, Erica, Phil, and myself presented and represented the Pikes Peak region, it was a much higher representation of presenters from our area than Denver when you look at the numbers of membership. So thank you guys for stepping up and presenting. I will say the sessions were very low attendance because most people were excited to be in Estes. My favorite part of the conference was just to see how much the transportation realm has taken COVID seriously. And when you walked into a room, you could just have comfort knowing that everybody not wearing a mask was vaccinated. And for the most part, the entire room was vaccinated. The people wearing masks were just being extra precautious. So it was amazing. I will give one hint though, if you ever go to a conference in Estes, do not ride a horse in Rocky Mountain National Park for 2 hours the day before the conference, because sitting in the conference is extremely uncomfortable. So very good lesson learned. I'll be going to Moab after the Grand Junction conference to do my Jeeping.
Do I need to put that in the minutes? I just need to ask. Okay.
So we're going to turn it over to Laura to give us all her updates.
All right. Updates. A couple of things. So those of you know that we launched our RFP for 5310 March 31st. It's ingrained in my head. And we had 4 applicants that applied for funding through 5310. We assembled a review committee of some people from the RAC as well as CDOT. Glenn's on the call here. He was on our committee. It was really great to have Glenn on the committee because it's a new process for me. It's also a new funding stream for some of our well-seasoned community members that serve on the RAC to kind of go through. It's a lot different than the AAA process. So it was great to have his insights as well as others in the process of looking at those applications. And so from that, we had put together a score sheet, which is a requirement of FTA to be able to assess applications through a competitive process. And so that score sheet was available to all of the agencies that applied ahead of time. So you could see kind of the areas of how they were weighted in accordance to, different aspects and criteria that were very important to just the grant as well as PPACG. And so from that, there was a result of looking at those proposals, and 2 agencies scored really high, and they were just right next to each other in all aspects of the scoring. And so those were Invita as well as Silver Key. And Fountain Valley was just a little bit below that. But in looking at those scores, the determination from that review committee was to fully fund the ask of Invita as well as Silver Key and utilize the funds that were left over of those 2 for Fountain Valley's program. And so we also had one other applicant, which was Community Intersections. Dick's on the call today. One of the things that we have kind of learned through this process is just the eligibility of programs for 5310. And so with that, we evaluated their application and the programs that was presented, and it didn't match up with the 5310 requirements. And so we're going to work with them in the future to kind of better understand their programs, PPACG is better understand their programs and figure out, different ways that we can partner not only with them as well as others in the room that may do different programs besides specialized transit, or may do specialized transit, but may not necessarily have their programs formulated or aligning with 5310 in the future. So the other piece of it is we have other funding opportunities that come across that, as I know more and more about your programs, I'm able to plug you into those funding opportunities, which is important. We actually had a grant come through CDOT last fall for agencies that provide specialized transportation to seniors as well as individuals with disabilities. It was a directed grant to specific agencies, but we were able to serve 2 agencies that are a little bit outside of our spectrum that we typically serve with the AAA through that grant. And so there's just opportunities that come down that it's very important for me to have a good understanding of what you do so that when I come across something, I can target that to your organization. So I'm not just a AAA employee, just to kind of clear that up on the call. I work for PPACG. So my role kind of overlaps between the AAA and transportation planning. So even if you're on the call and you're not associated with senior programming, I'm here for you. So that's the main thing. The other thing I want to update you guys on is the mobility guide. All right, we put together a Google Sheet. I've been through that Google Sheet with you guys, a couple of meetings. There hasn't been a lot of movement on that. I'm going to put your feet to the fire a little bit to really look at that Google Sheet. I will resend that out to you guys. I could really use your help filling in some blanks that are not just from your organization, but other organizations that are on there. You may have a better connection with those organizations than I do. Chances are you do, because you've been around a little bit longer than me. The mobility guide is just a starting place for us as a community, just to make for sure that the information that we're putting out there as a group, as well as with the AAA and through PPACG, is right. So one of the things that I included in there, and the way that I made it was in a Google Sheet so that we can update that information on a regular basis. So if there is changes within your organization, or maybe you find an organization that's on that list that's no longer providing services, you can take that off and we can make notes and just better communicate with each other as to what we're doing. So, and that can be used as a basis moving forward for any kind of project that we want to do. I know that Boulder has done a great job at sort of a mobility for all type of platform of being able to communicate to the general public just how to get around. And so I know that there's people in the room that have been working on similar projects, and that can be used as a tool to sort of wrap that information into it. So those are my main updates. I do want to kind of pose a question, and maybe this should have gone in public comments, but sometimes I don't know if I'm the public or not. I do want to pose the question as to, what do you guys really want out of these meetings? I have been connecting with a lot of other mobility coordinators that manage these types of groups, and I want us to figure out what we want out of them, as well as what can we produce out of these meetings. Because I think that we can kind of engage ourselves as a group to really start producing things for the community and producing things for each other. And so I want us to kind of think about that. I'm going to put together a survey and run that through Jolene and a few others to start thinking through what that may look like in the future. So I know that there hasn't been a mobility coordinator in this position in a long time. I did connect with Angel several times. I know that she was one of the last ones around here. But just want to figure out ways that we can kind of point the group in a direction. So yeah, cool.
Thank you, Laura. And I would stress helping Laura with that Google spreadsheet. As you guys have all seen, funding applications for everything going forward from the feds is collaboration. And that spreadsheet is the basis of starting collaboration. And that's what Laura is trying to do, is help us move forward as a region. And I do have one other thing that I probably should have said in public comment as well. I was talking to Jason and Gail about this, and they were interested in the results, but so we're excited on the transportation side that, you know, there's no capacity limits, but mask wearing is still required on transportation. But when we're looking at reopening the senior center, I think COVID has definitely highlighted ageism in America and telling seniors what's best for them without actually having any input from seniors or the disabled that ride our transportation. Like, shocking. And me and my board don't necessarily always agree. Shocking. Can you imagine people not agreeing with me on our reopening plan? So I had suggested that we send out, of course, Sharon always agrees with me though. Hi, board member. So we sent out a survey to our seniors. It's a membership organization. We wanted to know what they wanted in reopening. We mailed it out Thursday, and everyone here knows that normally surveys are never returned. We mailed out like 530 surveys. We got 91 back yesterday on the first day the mail was available. So they definitely want to have a voice in COVID. And of the 91 that responded, 91% of them are vaccinated. So we will be hitting herd immunity numbers. And then our biggest quandary in reopening, which I think is similar to a lot of programming that we all do, is how do we reopen? Like, do we reopen with CDC guidelines, state guidelines, make vaccinations mandatory because it's a high risk population, like all the topics that nobody wants to talk about. And it's interesting because the results so far are 27% of seniors say absolutely no restrictions, like let us just do whatever we want, which obviously is not legal, PS. 21% want everybody to wear a mask at all times. 45% want non-vaccinated people to wear masks in the building. And 25% want proof of vaccination mandatory with medical and religious exemptions. So it's interesting because the non-vaccinated mask wearing is pretty much the norm. And it's nice to see that their results are going with what the norm planning is, but at least they have a voice. I will say, however, though, on the seniors that take trips out of town or on our vehicles longer than a standard like 30-minute ride, 88% of those that go on out of town trips and overnight trips say mandatory vaccines because of how long you're sharing the airspace. So it is very interesting to see. And Silver Key will be reopening connection cafes coming up. And so these numbers are just nice. And we're going to share our data with Silver Key because it's very applicable to the same data set. So we'll share all our raw data. And if any of you guys want the raw data too, to take to your board so you're not duplicating any efforts with the senior population, we'll be happy to share. Because I mean, it's going to be this, I want to say it's going to be the same across the board. They all have the same concerns. So at least we are getting what the seniors want. And this would have gone out to any of our under 60 disabled that are members as well. So all of that data is included. And we broke it down by three age groups, 50 to 60, 60 to 70, and 70 plus. So
I do have a question for those that are here and on the call, that I may not have as much connection or day-to-day connection with. John, I'm going to kind of put you on the spot. Now that some of the changes have occurred in terms of, lifting of restrictions and like CDOT lifted, or the state lifted the restrictions on how many people can be on a bus and that kind of thing. How is that changing, your model? Because I know that some agencies on here had to kind of discontinue their transportation services.
We, over the course of COVID, did trim our transportation services a lot, and we even sold off some vehicles. I think we're down to about a dozen vehicles. And our ridership dropped and hasn't really rebounded yet. So I don't know that the recent changes have really impacted us or gone into effect just yet. But we are slowly starting to see clients come back in, and we're also still seeing clients in their homes as well. So mainly our program for adults is the one that was most impacted. Zach's place has been busier than ever. And I know over there, the fact that we can have more on the vans at a time has been a big help, a big boost to just, because we do run kids, drop them off at school in the morning, pick them up in the afternoon, or maybe take them to other programs that they attend. So that's seen a slight uptick there. Not so much in the adult program yet.
Cool.
Hey,
Thank you.
If you don't mind, can I jump in on this topic right here?
Yeah, go ahead, Dick.
Yeah, we received the same email that you sent out. We think it's a great start, but we get our authorization for payment from everything from HICPUF. And we're waiting to hear from HICPUF before we increase our ridership. Right now, we're doing ridership as 5 people plus the driver for the adults. And until we hear from them, we're going to continue following those rules. And hopefully we're here shortly after Memorial Day. We'll hear from HICPUF on what they're ruling on what they decide on that. So we have not followed the state's guidance because HICPUF has not said anything.
That's good for me to know. I didn't know that hadn't changed yet. Yeah.
And I can stem on that as well. I just got an update a while back from our day programs, and they said similar thing that a lot of our folks with disabilities are all Medicaid funded. And so unless everyone on the vehicle is vaccinated, they have to wear masks and still have the limited occupancy. And then if everyone's vaccinated, then they can follow those state rules. So they're kind of doing the same thing as easing into it and following that.
Yeah, yes. So we're starting to track our clients, not only clients coming back, but if they're vaccinated or not, and have to prove it. And right now we're looking at about 50% of our clients that are vaccinated.
And I just want to touch on what Kristen said about mask wearing. The federal mandate on any public transportation is masks are mandatory for all passengers, all drivers until at least September 16th. So even if the entire vehicle is vaccinated, the mask lifting does not apply to any public transit.
Yeah.
If you want me to further complicate things over here at Metro, since we don't fall under Medicaid, we don't follow those rules. So for us, much like Jolene said, we obviously have the mask mandate ourselves, but we don't require proof of vaccinations. And I know a lot of the day programs use us. So we won't be able to ask. So that could further complicate things as some of those people start to come back, just so everyone's kind of aware.
Yeah, thank you. That's good info. I don't know from our programming folks yet if they're asking for proof of vaccination yet. I just know our occupancy and our attendance rate is still quite down.
And I do think it's interesting because so many of our agencies do dual purpose transportation and other programming, because on our transportation side, we'll never ask for a vaccine card. But on our building side, we'll be asking for vaccine proof to not wear a mask. And it's interesting because you're more likely to get COVID on a bus than you are from coming in like eating lunch. So the irony is just there. Well, actually eating lunch is a high risk activity, playing bingo. And it's interesting how many different funding sources we have that to navigate the rules between the feds, the state, then CDOT, HICPUF, then our boards, then like thankfully PPACG hasn't thrown in any like extra rules. Thank you, PPACG. But you know, we have to check the boxes and you have to be the most conservative of your most restrictive funding source, which is making this very interesting. But we're in person and I hope to see more of you if you're vaccinated in person next month. Just to celebrate, it's really nice to see people in person and watch people's mouths move when they talk. Does anybody have anything else?
I do have a question out of that. So, you know, Anne from Casta, as well as myself, we're always like trying to figure out what's in y'all's heads about how this should go. So if you're running into barriers with like a HICPUF or this kind of one federal agency or state agency is making you do one thing and one is making you do another, what is the best case scenario for you guys? Where do you feel safe with your customers, and what changes do you feel like should be made within those programs? I think if we don't put that out there and we as a group say that, you know, I say to take this back and say to Anne with Casta, okay, representing Colorado Springs MCC, this is our message on what we may want some changes to be. We need to kind of formulate that. So I know, Gail, I knew your hand was going to come up.
What we found is HICPUF has been very responsive, listening to the community around the state regarding all kinds of things regarding the safety of the population that is health first or Medicaid members. And they are very good at publicizing what they want in operational memos or policy memos that they put out on the website, and we track those. But it is the population of the IDD community is probably, I think, most high risk group. And so they are very conservative about their program and how people are congregating. And so it does apply to the vehicles and the bus, but they do publish those operational memos and they have been responsive to our needs. But it is around the safety of the person that we're also.
So with that being said, kind of in general, we're okay with some of these restrictions that are in place because of, you know, kind of the due diligence of that they are taking to kind of read the population that they're serving and communicating with the population that they're serving to figure out what their needs are. It's not just somebody in the room making decisions. So we feel comfortable with what's going on right now.
I think we're all comfortable with conservative guidelines right now because we have a moral obligation to reduce the transmission, and none of us want a contact or someone to catch it like on our vehicle or in our building. I know that's my biggest fear in reopening is I personally, like, my head tells me I wouldn't be responsible, but my heart just says, like, I don't want anyone to contract COVID and die from a meal, a ride, a game of bingo. Like, that's not worth the risk. So I think, and I don't want to speak on behalf of everybody, but I think I am with the nods in the room that we just serve the most vulnerable populations. Not fixed transit though, Jacob, that's everyone, but the seniors and the disabled, we just want to see restrictions more slowly eased than like have at it so that we can see what the ramifications of that is. I would rather see it, a slow moving. And if there's an increase in cases or deaths, it's only a couple versus zero restrictions. And we start seeing seniors and disabled dying again at alarming rates.
I think, Dick, your statistic about 50% of your population that you serve has been vaccinated is very telling. And so, I agree that we in VITA will be very conservative on how we serve that population. And I appreciate the PASA organizations that are conservative.
That was good for me to know. Because I sometimes you get mixed messaging, because I know that it's been a frustration as well, because I know that it's been a lot more work on you guys to be able to provide those services, which I know is taxing. But it's good for me to hear from you guys how stepping back from those frustrations and those challenges, you're really keeping the person at the center of it. And so for me to have a better understanding, that's great. Cool. Well, that's helpful.
Anything else? Fantastic. We're going to adjourn at 10:16. Oh, yeah, I've never been given this before. Adjourned. Jessica might regret this. This is like giving me a microphone.
Thank you, guys.